My name is James McLoughlin. I go by Jim. I focus on surgical oncology, which is a surgical specialty focused on patients that have a cancer diagnosis. And when I was 14 years old, my very first surgery was helping a veterinarian untwist a stomach in a cow in the barn under very unsterile conditions in hindsight. But it really intrigued me into the sciences. My main interest is really in the abdominal cavity, and so that includes colon cancer, rectal cancer, stomach cancer, esophageal cancer, liver and pancreas cancer. So I had an opportunity to spend about 8 weeks doing rural African primary care and surgery, and I realized through that experience that surgery was really where I wanted to pursue my medical training, my medical career. Ended up in Dallas at the Baylor University in Dallas for my surgical residency training, which is 5 years, and then I did an additional 2 years of surgical oncology or cancer-based training at the H. Lee Moffitt Cancer Center in Tampa. I chose UT Medical Center for a few reasons. I had an opportunity to work elsewhere within the South and the Southeast, and the UT Medical Center is really known within the surgical community for being a very physician-friendly place to work, meaning that we get a lot of support and a lot of encouragement from our peers, our leadership and our administration, and that has been part of the reason we recruit so many excellent folks and why everybody wants to stay here. That we really are allowed to treat patients without restriction and without micromanagement. And for those that have a loved one, or even in my case, personal loved ones who had a choice, and the question becomes which place to visit. The best place for you to be treated is here at the University of Tennessee Medical Center. And we want to make sure that the patient experience is better. We want to make sure that obviously the cure rate's better, that we have the most up-to-date treatments, that we're implementing them on the right folks, that we minimize side effects. That is really ingrained in what we do here. We don't accept yesterday's results. We keep moving towards better outcomes, and we know what we have now, but we're going to work to make it better. They get a real person on the phone. They get a very engaged group of folks, from those that greet them in the entryway to those in the office. Many of our employees and volunteers are cancer survivors themselves, or had family members that walk that same pathway, and it's a personal touch that comes from a real experience. We also are very team-based and team approach. So almost every new patient that comes through with a new diagnosis has been reviewed by an expert team. We review the national guidelines, and we can make sure they have access to the highest level surgical treatment options, medical oncology options, all right here on our campus. That first visit can be focused primarily on establishing a relationship between the two of us. We do have an expanded team, including our navigators, and many within that navigation team that will help make that first visit and that first encounter as efficient and successful as we could possibly hope. But we leave that meeting with a plan and the next step forward. And that's often the biggest relief for individuals, is to be able to come in and have a definitive plan and understanding of what the team has decided upon and recommended, and next steps, and how the next week, month, 6 months to a year might look, and how they can prepare for themselves. I met my wife, who is a pediatric and neonatal intensive care nurse, while I was doing my residency. So we met there, and we're married. We have 4 kids. We like to do anything camping related. I have 3 boys, and my youngest is a girl. And all of us love to be outdoors and be around a fire pit, and just to spend time together away from electronics or Wi-Fi. My wife and children love the neighborhoods, the school systems. The natural beauty is unparalleled. We've absolutely been very grateful to be here, and hope to not ever leave.